Hey everyone, Evan Kirstel here with another great CPAS Acceleration Alliance Summit. We're talking about CPAS in healthcare and how we can both reinvent and transform the healthcare tech, healthcare IT space with CPAS. Gentlemen, how are you?
Good. Good to see you.
Yeah,
Good.
good to see you both. We got the world covered here: U.S., Europe, Middle East, with my esteemed colleagues here. Ralph Page from Radisys. Do you want to introduce yourself and perhaps for those who aren't aware, who's Radisys?
Yeah, sure. Thanks. So thanks for inviting me to participate today. So my name is Ralph Page. I'm the email sales director for Radisys, and I actually look after our sales and business development for the CPaaS solution known as the Engage Digital Platform. So for those unfamiliar with Radisys, we're actually a market leader in media processing technology that's utilized in mobile networks, so unified communications, conferencing services, and transcoding. And we're actually a partner, sometimes a hidden partner for some of the best known telecom vendors such as Nokia, Samsung, ZTE, Zoom, etc.
Never heard of them.
We've been in, yeah, so we've been in media processing business for over 20 years, and we have around 70% market share. So you might be wondering, why is that relevant to a CPaaS discussion, exploring the benefits of healthcare? Well, based on our media processing experience, we've actually developed a CPaaS platform. We call it the Engage Digital Platform. And it offers not only the traditional CPaaS APIs, such as voice, video, and chat, but what I like to think of as the next wave of CPaaS APIs. So heavily based on our experience in media processing, they can include things like AI-based bots with natural language conversation, biosecurity, like facial recognition, live translation, and a whole video analytics.
Except Bluetooth. I don't believe Bluetooth is part of the portfolio of Radisys.
Yeah, I wish it was. I could control this thing. Anyway, just to finish off, so these APIs and SDKs have actually enabled us to create some very healthcare-specific applications. But the thing I want to talk about today, and I hope we touch on it, is we've actually along the way unearthed some unexpected benefits. So how CPaaS we thought would do something, but ended up doing a lot more, and maybe we can touch on that as we go through.
Excellent. Thanks, Ralph. Thanks for the intro and overview. We'll sort of dive right in. Shabazz, maybe introduce yourself.
Absolutely.
Fascinating cities around the world in Dubai, and introduce EN Enterprise and what you guys do.
Absolutely. Even so, hi, my name is Shehbaz. I have almost 8 to 9 years of experience when it comes to telecom servicing industry. I moved to Dubai, I think 1.5 years back, and I joined, back then it was not EN, it was Etisalat. But then we transformed into a group. We made a group called EN, and under EN, we had different companies. So one of the entities that we actually made was EN Enterprise. The reason why we made this particular entity was we want to target the enterprise segment of the UAE. Of course, everyone knows that Etisalat is one of the largest telecom operators in UAE. And we did not want to be just the telecom operator of UAE. Rather, we want to target the digital industry. So within EN Enterprise, we introduced different verticals such as cloud, contact center. One of the verticals that were introduced was CPaaS. You guys know very well, this is one of the most exciting technologies of this time, especially after COVID. CPaaS was leading the way for everyone to enable communication, to help each other out, and whatnot. So what we are doing is more or less what Radisys is doing. But what we do is we provide a suite of APIs. So we combine the textual communication, the voice-based communication, video, chatbots, whatever you can think of when it comes to communicating with your customers, or internal communication, or any sort of communication. We are there for you. We'll provide you an API. And on top, we provide you with our professional services. So what we do is we have an army of developers who help you in building different use cases. One thing that emerged after the finishing of COVID was the use cases. Previously, we used to talk about service. You want X service, we'll give it to you. You want Y service, we'll give it to you. But then we started talking about use cases, workflows. We actually sit with our customers, we discuss their use cases, we discuss their pain point, and we define a workflow for them, and then we design a solution for them, custom tailor-made. This is what we are doing in UAE, and hopefully we'll be going global very soon.
Fantastic. We're really excited to dive in and learn more about what you're doing. We have another guest in the green room. We're just going to bring up Ali. Ali, how are you? Can you hear me? Can you see me? Greetings.
Yes, I can hear you. Can you hear me?
Yes, good. We're just getting
Fantastic.
started here and we're diving into introductions. So maybe introduce yourself, a little bit about your background and what you're up to these days.
Fantastic. Ali Bahush here. I'm an AI practitioner and entrepreneur. I've been in this space since 2010. And I've had worked on projects for AI in different industries, including in telecom. In telecom, mostly in terms of the marketing side, CRM, managing churn and things like that. And there's definitely fantastic opportunities for using AI, either for the management of the telecoms themselves, for example, preventative maintenance, or for example, the better utilization of network, or for using platforms on top of the telecom network to provide higher quality customer service, next generation call center, or things like that. Super excited about this panel discussion and to learn what the possibilities are.
Fantastic. Well, thanks for joining. And where are you based? Where are you dialing or calling in from?
I'm calling in from Madrid, Spain, but I'm between Spain and San Francisco.
Fantastic. So quite the global perspective here, which I'm excited about. I'm actually in Porto, Portugal at the moment at a CX summit by a company called Five9. But let's start with you, Ralph. Why CPaaS in general, but also why healthcare? Why is the time now for adopting, deploying, using CPaaS platforms in the healthcare industry?
Yeah, I think Shahbaz actually touched on it in his introduction. So as he said, they do a lot of custom work, and they always get with the customer to understand what it is the customer's problem is and how they can help. And I think what we've been discovering is, we all started off, I guess, with telecoms kind of user cases. We all understood customer experience. A lot of us have got a background in contact center. So, we thought, well, we can use our CPaaS APIs to help with the customer experience, perhaps calling into a doctor's surgery to ease the way they do appointments. But as we started to work closer with the health industry, to be honest, we got really excited because we started to tease out problems and issues that we would never have thought of because we're not medical professionals. And we very quickly realized that it wasn't just a case of us taking our telecoms capabilities and saying, hey, why don't we improve the way a customer actually dials into a doctor's surgery? We can actually impact patients' mental health. We can change the way patients are communicated with. And by working together with these health professionals, we actually have started to build a set of user cases, but I'm hopeful that we're only just touching what's possible, because the more the health understand what it is we can do, the more questions they'll ask us to say, hey, can you do this? And we might be able to say, yes, we can, or we might have to go away and think about it. But in general, healthcare has a huge potential. It has a lot of problems, and I think CPaaS can do a lot to fix them.
Yeah, and I think there's so many low-code, no-code approaches now with CPaaS to enable rapid turnaround of fixes and call flows and enhancements and features. That's typically been quite a drag, that technical debt in the health IT world. And this is something a lot about, Shahbaz, about as a developer, as an architect, a builder. What kind of things are you most excited about? What applications or sweet spots for CPaaS in healthcare IT?
Right. So I like to call myself as an enthusiast and a digital architect. I'm not per se a developer. We have a different team who develops these things. But a very good question. So see, when you mention low code actually changed the way we used to see things. Previously, what used to happen is if you want to have one change in your current application, your IT would give you an SLA. They will tell you that will take 30 days to make this one change because it includes coding, it includes this and that. Maybe we have to increase the resources that we are requiring right now, so on and so forth. But with the invention of this low code, no code thing, even if you're not technically sound, if you're not a developer, you can just sit on your desk, you can just hit and try, and you can drag and drop boxes, and you can come up with something that is absolutely new. And this actually changed the whole workspace, the whole landscape. Well, like I mentioned, after COVID, one of the things that we saw is people started learning new things. They were sitting at the convenience of their homes. They started exploring things. And I saw people who had no background of IT, who had no background of engineering or anything that's related to technology. And at the end of this bad period for humanity, they came out as full-fledged developers. They started working on Upwork and selling their services. So you see, this low-code, no-code thing, it actually helped us massively. And when it comes to the development part, now it's not about the hardware. It's not about the someone who is well equipped and know how to do coding on Python. The cloud infrastructure replace the hardware. You just ask your vendor or your provider to just increase my resources, and someone who is sitting at the desk at your office, you can ask them to make these changes, and they'll do it on the go. That's great, and that's the beauty of low code, no code.
Fast feedback loops. That's critical. And Ali, what about you? What most excites you? I think someone's typing. What most excites you about the CPaaS opportunity in healthcare?
I think the key value that I see is it lowers the barrier to entry, and it creates an environment where, like Shahbaz was saying, the practitioners themselves can start actually to create a playground where they can test ideas even before you can bring in professionals who can create enterprise scale solutions. And that's very important. Like Ralph was mentioning before, I can speak for myself. I'm not a healthcare professional, but I've worked with healthcare. I provided digital solutions for them. And the key thing is for us to create this space where both the technology provider and the healthcare provider come together and start actually co-creating what the solution is. And I think that's where this idea of CPaaS, with all the layers of abstraction that it brings, and concealing the complexity away from the end user, and creating these platforms and opportunities where there are opportunities for co-creation. That's extremely exciting.
Yeah, I would totally agree. And Ralph, I've seen so many cool demonstrations and use cases here from Radisys, things like real-time language translation on video calls, really amazing capabilities. Are there any early deployments you could talk about that are super relevant to the healthcare space? I mean, I've seen transcription and transcoding and monitoring. I mean, that really it's just so many capabilities that could be leveraged in healthcare.
Yeah, I mean, it was like I said, the example I'll give you is going back to the doctor's surgeries, because it's one of my favorite areas because we've done so much work with them. And in the UK, after COVID in particular, a lot of companies were going for remote, a lot of doctors were going for remote consultations. And the way that works in the UK anyway is in the morning, the receptionist gets all the calls, she creates an appointment sheet, and then the poor old doctor has to spend the rest of the day essentially calling people's mobiles and trying to get hold of them to have their appointment. And often that doesn't work because there's a poor signal, or maybe they're standing in a crowd and they're embarrassed to take the call, so there's a lot of time wasted. So our first idea was, well, how do we solve that? Let's use some of our chatbot to create like a virtual waiting room. So instead of getting an appointment with just a phone number, what happens is the receptionist sends an email to the patient, they get a link, they connect on the link, and it takes them into the virtual room. The bot welcomes them, and then when the doctor's ready, he can click on, or she can click on a button and then start the conversation. So the doctor's constantly working, they're not chasing mobile phone. But then what we realized was, okay, actually they're then hanging up and then writing some notes. So why don't we use the transcription API, add that in, and then we can actually do like a subset of the actual. We don't record everything. It's like just the highlights of the call, and that can go into the patient's records. So they've got a permanent record. And then we thought, sometimes they get calls, people who have come over from China, they've got sick, they're making a call for help, but they only speak Chinese. Well, let's put a translation app in the corner so the doctor can click on it and say, please translate my words into Chinese, and vice versa when the patient talks to me. So you just build up these user cases. So that's an example of a simple app that we built for a doctor's surgery that then started to get better as we started to learn how the doctors were behaving.
Yeah, that's such an interesting example. And it's also about cost savings. I mean,
massive, yeah.
As much as automation of can be done on the front end, on the back end, we've all seen the challenge of reducing costs in healthcare, particularly in the US. We spend the most of any country in the world. There's just a huge imperative to reduce costs of all kind, CapEx, network expense, operating expenses, communications, services costs. So really, that's quite an interesting one. Shahbaz, what about you? You must see all kinds of different use cases for CPaaS. What are some of the services that you've seen get traction based on a CPaaS platform?
Yeah, so I'll talk about one of the live customers that we have recently, because you mentioned cost optimization. Their pain point was cost optimization. They were insurance healthcare provider and a medical company. All the billings and everything was being done by them for the leading hospitals in the UAE. What they were having issues with, they were receiving unlimited calls in a day. People were asking about the statuses of this insurance, if the claims came in, so on and so forth. And a lot of these calls were going unanswered, and the SLAs were through the roof. So they reached out to me, and we discussed the use case, what kind of problem they were facing. And we said that a lot of these questions were around the timings of the institutions, were around whether my claim has been approved or not, what's the status. Most of these things could be answered by a chatbot. And what we did was we defined a chatbot for them. We integrated with their internal insurance system. So we saw actual cost reduction, and these guys actually came to us and saying that we reduce our cost by this X percentage. And we now like to explore more use cases with you guys. So when it comes to CPaaS actually helps you in reducing cost. It elevates the customer experience. So previously, if 10 calls were being unanswered out of 20, now they were answering each and every call. And the beauty of CPaaS is there are some platforms which provide you such detailed SLAs that a call center agent who is defined on maybe WhatsApp or any other channel for that matter, how much time they took to answer a call, how much time it took to resolve something. And you know what? They actually translated all of this into their call center agents' KPIs. And they linked some revenues with it as well. They linked some bonuses with it as well. If an agent was reducing customers' complaint in a good time, they were being awarded for it. So this is something unforeseen. You were not expecting this, but this came out of CPaaS.
Yeah, that's really interesting. And we're seeing now the emergence of large language models, which could really supercharge the ability to have, multilingual chatbots with natural language. Really exciting time. Ralph, one of the challenges in the U.S. healthcare system is the whole thing is tied together with like fax machines and and monolithic software, in form of VHRs that was like written something out of the 70s. It looks like. How do we bring that into the 21st century with video, with messaging, with modern protocols, right? With all the bells and whistles we're used to when we go online and interact with advanced web services like is it a technology problem, or is it, in terms of developing the apps, is it a mindset, or what's going on, do you think?
Yeah, it's probably the hardest question to answer, I think, certainly in my experience of the UK especially, is this problem of old systems, because they're still relied on. Quite often they are a legal requirement, so you can't just decide you're going to do it a different way. Certain things are not allowed, and there's a huge fear when you say to someone, for example, we're going to use a chatbot to check whether patients are allowed a repeat prescription, and if they are, we're going to send it to the pharmacy so that we don't have to have the receptionist or the doctor answer the call. And the first thing they go is, oh, no, you can't be having a chatbot giving out prescriptions, because how do we know that they're allowed to have a prescription? How do we know they are who they are? And the honest answer, at the moment, I think, I'll be interested in what Shabazz thinks, but is we don't have all the answers to that. So the use cases you're seeing that are very successful either don't touch some of these areas and you just have to live without them, or we're able to in some cases we can get, we have to go and get permission, or maybe we have to hold the data within the group of surgeries or within the hospital. It very much depends on a case-by-case basis. Unfortunately, I don't have a golden bullet for that one.
No silver bullets or golden bullets. Ali, what say you? What's it going to take to modernize our healthcare infrastructure? CPaaS is, one interesting part, but what else?
I can tell you from my experience during the COVID period, we have worked with a number of healthcare providers. The first one is they're not educated about what is the potential of what technology can provide. They're not aware of the possibilities, the benefits that the technology brings, whether it's cost optimization, improvement of the patient experience, and even opening up opportunities for innovation and advanced therapeutics. For example, when we were working with a hospital that was being overwhelmed by all the calls from people who are either patients or people who suspect that they may have COVID-19, they immediately figured out that an intelligent chatbot that could do some first-level triage and actually do some intelligent routing, so that you're not having a registered nurse actually answering calls just to tell person, you're okay if you don't have this list of symptoms, you're just having a headache, you're an asthmatic patient, just take your regular medication, you're okay. It's such a waste of very precious resources. And if we leverage technology and platforms like CPaaS properly, there is tremendous opportunities for us to improve what the condition of healthcare is today.
Yeah, I would agree with that. So the UAE is known as the digital first, very modern country, adopting all the latest greatest technologies, from AI to blockchain to pick your tech. So are you at the forefront, do you think, of new services being developed with CPaaS? And what can we learn from you in the US, where we love our fax machines and clipboards and voicemail still?
I was actually surprised when you mentioned that you guys are still using fax.
Still only.
So I'll answer this. So recently our government in UAE, they announced that the healthcare providers, they have to have at least one remote service, and it has to be mandated. So any healthcare provider who is licensed from UAE, whether they are in Abu Dhabi, whether in Dubai or any other state for that matter, they have to have one remote service. And these remote services maybe include telehealth consultation, remote facility of providing medication, checking your vitals, sharing your reports, something like that. On the same line, also it includes robotic surgeries as well, remotely, and this is mandated by government. So you can expect the level of enhancements our UAE government is doing when it comes to healthcare facilities. We are also working on something called medical tourism, to improve this industry, because there's a lot of potential when it comes to healthcare services. Now, CPaaS, what it does is it complements the healthcare services. My Ralph mentioned about the use case of chatbots. Even Ali was talking about it. The only problem is it's a little gray. So let's say a customer comes in and says that I am having COVID symptoms, and the AI chatbot. So what right now happening is we are having NLU based chatbots where we define keywords, where we define the intents, and so on and so forth. So based on those intents, based on those keywords, you give a response to your customer. And let's say the customer was actually having COVID, but your NLU or your keywords decided that no, it was not COVID, it was just headache. It can land you in deep waters. But this is being replaced by full-fledged AI solutions now. So we are actually working on something. We are trying to integrate ChatGPT in our chatbots. So ChatGPT will actually give you the answers that you're looking for. And of course, the possibility of connecting to an agent has to be there always, because an agent can give you the right information. AI, NLU, still, we are not at a stage where they can give you 100% accurate information. But yes, of course, in routine cases, the AI chatbots, they help a lot. But when it comes to UAE, I believe if we are way advanced when it comes to the curve.
Yeah, it's interesting. I mean, the GPT opportunity is huge, but it's not in the places we think about in healthcare. It's things like summarizing content for doctors and nurses and providing highlights of policies and procedures to patients, or it's in translation. I mean, every language on the planet has been fed into GPT-4. And this allowing us to communicate almost perfectly instantaneously across every language. It's really, really fascinating. So, Ralph, to give us a little bit of context, I'm in the U.S. We've got Dubai here, the UK, Europe. What's holding back the adoption of CPaaS? At the NHS, for example, is there a way to accelerate this technology? I know it's coming in the U.S. It's coming from the outside in, with Google and Amazon and other players entering the healthcare space, Microsoft. Is there that sort of opportunity in the UK to get, fresh, insights and new players to sort of reinvent the NHS, or is that not in your system, which is very different from the U.S. or Dubai? Is that even possible?
No, absolutely. I mean, the NHS is a beast that covers a wide range of medical solutions. From basic doctors right to major surgery, and it has quite a few problems that can be solved. My honest answer is I don't think it's. We've been talking a lot about high-end, I'll call it high-end CPaaS. So we've talked about chatbots and AI and ChatGPT. But even really simple things, if you know about them and you understand the problem, can solve it. And people have heard me use this example before because it really, for me, shows what I mean by this. We had a case where we were able to completely change the way patients were interacted with by changing a ringtone. And what it was essentially it's an app for people having, unfortunately, mental issues. And essentially, the app would ask them some questions every day, and it would go back to their sponsor. Their sponsor would essentially see the responses to the questions, and if they felt intervention was required, they would call the patient to ask them if they were okay. And what was the problem? Well, they wouldn't answer the phone, because if they're having mental issues and they're having a bit of an episode, they often don't want to answer the phone. So they came to us and they said, well, have you got a way that we can change that, the way that we do that? And we said, well, why don't you embed a call in your app? So instead of you having call in their house or their mobile phone, call them through the app. We'll change the ringtone so they know the only person who can call them is their sponsor. And I'm not going to say everyone answered the call in that case, because obviously people with mental health problems don't always answer the call. But the number of people that then answered that call that didn't previously, because they were afraid it was their, husband they were divorcing, or the bank manager, they knew it was their sponsor and they would answer it. And we did that just with a ringtone change. So to go back to your question, do I think there's many things we can do? There's many things we can do with the clever stuff. There is a huge amount we can do with what we in telecoms almost consider table stakes, because the people in the health industry don't know we can do it. And if we can cross that barrier, then the NHS, and I'm sure all the other health groups in the world, would find many, many user cases.
Well, I love that perspective. And Ali, is it about incremental change? Is it too much to expect, radical transformation, or do we have to just go step by step and start with text messaging and then work our way up to GPT-4?
I totally agree with Ralph. Sometimes I think we overlook the simpler cases, but they're the ones actually who prove the viability of the technology. Just an example from our experience, we worked with an African government where we tried to introduce the most basic telehealth service for rural areas, and it was actually through SMS messaging. And again, what you can do is everything from a person, first of all, not feeling isolated and feeling that they can use the most rudimentary telecommunications means, and that's the important thing for success of a program like telehealth, and being able just to SMS a simple message and get a response in terms of whether you need to go see a doctor or not, where is the nearest location, depending on where you happen to be or where an accident happens at the moment, is super important. So totally agree. We don't need to start with the most sophisticated AI-driven chatbots and what have you. We first have to understand what the needs of the people are, both the patients as well as the healthcare practitioners. Look for where the low-hanging fruit are in terms of actually leveraging technology to advance the goals and objectives of whether the healthcare provider, the insurer, or the patient themselves, and then build from there. Because as we spend time as technologists with our end users, be it again the patients, the healthcare providers, the insurance, the whole ecosystem, it'll become obvious to us where these areas that could benefit from the technology, especially from something like CPaaS or the telecom and information technologies in general.
Oh, great perspective. And Shahbaz, would love to understand what's next. You've built a platform, you're developing applications. Where do you go next in Dubai? What's on the radar for you as far as new and innovative services and applications enabled by CPaaS?
So for us, it's for sure AI. Like I said, right now it's not AI, it's NLU, Natural Language Understanding, where you define keywords and intent and so on and so forth. And of course, we'll keep on working with the APIs, and we build everything custom made for our customers. For me, CPaaS is modular in nature. Back in 2013, there was this thing called Project Era by Motorola. So they actually came up with a phone with different modules. If you want a bigger camera, use the camera module. If you want storage, use the storage module, so on. For me, CPaaS is the same thing. You want SMS? Okay, we will plug in the SMS module for you. You want teleconsultancy? We'll plug in the video API for you. Any service that you can think of, we have an API for it ready, rock and roll. But again, we need to introduce some sort of intelligence, proper intelligence when it comes to ChatGPT 4. Wherever you want, it will answer you and it will give you live data. And there are a lot of prompts that are being fed to it, and you can get actual feed from it, not the NLU, not the intents, not the keywords that you define on the backend. And also, I like to mention one more thing here. I have seen this here in the healthcare facilities that these guys are already very well aware of this technology. They might not know that this is called CPaaS, but they know that there is something that we can use to address maybe getting a lot of calls in our contact center, automating processes, or using some sort of API to answer our customers when it comes to voice, video, textual, or any other sort of communication. Also in UAE or in the Middle East, we have a lot of these events as well. Recently, we had Arab Health, where we discussed technology advancements, so on. Also, we have now introduced a box that does everything for you what a hospital can do. So we are on the right track. We are moving at a very fast pace. And hopefully, this will not only enable the hospitals, but it will do good for the humanity as well.
Oh, fantastic mission. And Ralph, let me ask you, I mean, Radisys has so many of these building blocks, and you're always developing new ones. I think the last one I saw showed a real-time conversation between someone in Chinese and French, talking together real-time seamlessly with translation on a video call, not just audio.
Mhm.
I mean, that was mind-blowing. Imagine the possibilities for patient communication, et cetera. I mean, that blew my mind. But what's next? What else can you imagine as far as the underlying technology?
Yeah, so for me, the next thing that's really exciting that Radisys specifically are working on, I think, is the area of video analytics. So, already we can take camera feeds in old people's homes, for example, and we can say, has someone fallen over? Is someone unconscious? Are they shouting for help? We can already do that today. But I think what's going to come is someone can get me a CPaaS headset that works properly. I'll be very happy. Is the next level is going to be things like when we're having a call with a patient, we can already detect, or we'll be able to detect, have they got a shortness of breath? Perhaps their cough has signs of pneumonia, and AI will be able to spot that. So it won't just be the doctor listening, it will be the system will then say, we were listening into that, and we think you need to check the patient for X. So the next level of video analytics for me are going to be absolutely fascinating. And, and these are not, long-term things that I think can happen in 10 years. This is going to happen next year, the year after, on top of what we already have.
Wow, can't wait to see it. Shahbaz, what are you most excited about? Do you have anything coming up, any events or meetups or customer meetings? I know GITEX is coming up later in the year. I should be there, so I look forward to that, which is an amazing IT event. What else is going on in Dubai?
Absolutely. GITEX blows you every time you go to it. I mean, you see things that you can't even imagine, from flying cars to flying robots.
Mobile healthcare, automated healthcare kiosks. I mean, yeah, things that are incredible.
That's already done, by the way. Even in the last year, GITEX, we had this automated box. You just go sit in. A computer will do everything for you, take your vitals, do everything, suggest you the medicines. Also, if you want to have teleconsultancy right there and then, screen will pop up with your doctor's information. You select your specialty and you talk to the person, and that's that. And also, the insurance companies are now introducing kiosks where you can just go buy your insurance, claim your insurance statuses and everything. And what's coming next is we are doing a lot of things when it comes to the CPaaS ecosystem. We are trying to create awareness amongst customers, not just the healthcare, any vertical for that matter. We call for different roundtable, we call for different workshops for our customers. So one of the benefits that we have in UAE is almost 90% of the people are already using e-and services, and they are already our customers. So what we do is we not just for the business purposes, but we like to create awareness among the masses that this is something, if you will opt for and introduce in your business, it will not only reduce your cost, but it will help you elevate the customer experience. This is also one domain that we are now working on, the customer experience practice, where we will bring in all the expertise when it comes to CPaaS. And on top, if you want to elevate your customer experience in any way, we will help you with that. Like I said, we have an army of developers who sit with you, who discuss your use cases, who discuss your pain points, and they come up with the exact requirement. We won't tell you, please buy this thing from us. It may solve X, but it won't solve Y. For Y, you have to buy something else. No. We'll make something custom for you, which will be able to answer your A, B, C to Z, whatever problems that you're having.
I love that. So exciting. Taking great customer experience, turning it into great patient experience. Ali, what about you? Any trips, travel coming up, or events that you want to mention?
I'm traveling to Boston to meet actually with some innovative healthcare providers who are thinking about what the next generation of healthcare is going to be. Telehealth, I think, is going to be big. The whole pandemic period has proved that telehealth has a place to play. Even when the infrastructure, the requirements for it are not that high. You don't have to have AI to do telehealth. You don't need video to do that. Of course, to provide advanced services, you will. So super excited to see what next generation healthcare is going to be and what role telehealth is going to play.
Yeah, thanks for the insights. Thanks for joining. I know you had some technical challenges. I'm actually based in Boston, so maybe we'll be able to meet up. But in any case, gentlemen, thanks for your time. Thanks for your personal interest in the mission of transforming healthcare, important to us all. So good luck to us all as patients, either now or one day. We're all patients in one way or another. And, we all need these improvements, enhancements to come to life. So thanks, everyone. Thanks for watching. Thanks for enjoying, hopefully sharing, commenting, liking, retweeting, what have you. And we'll catch you on social media. And of course, as always, follow the CPaaS Acceleration Alliance handle and blog for updates. Bye, everyone.